Welcome to Life Passages, The Soul's Journey. I'm your host, Nancy Bloom, and this evening we're going to be sharing on the topic of post-traumatic stress, the truth about post-traumatic stress. And we have with us a wonderful woman, Diane Powell, who's a psychiatrist. She's also an author and a researcher and has worked in depth with post-traumatic stress for 30 years. And so I welcome you to our show tonight, and really glad you could be here to share with us about this very important area of post-traumatic stress.
Yes, it's a very timely topic at this time, as you know.
Yeah. And timely for many reasons, isn't it?
It really is. I mean, you know, if you look at, first of all, just Newtown, you know, how people are responding to that. People don't feel safe in, you know, their communities anymore. I mean, you know, a theater could have somebody come in, schools, a grade school. That really horrified people. I remember that I had many people come up to me after the Newtown. They were so disturbed by that, you know, that, you know, what kind of person could do this? And when I was a child, I lived in several different places, but when I was in 6th grade, we moved to Ohio. And within a month after moving to this new school, the neighbor who was right next to the school, all of a sudden one day he took out a shotgun and he started firing at children during recess.
Oh my God. So you, years ago, experienced some of what's been going on lately.
Well, yes. I mean, and back then, nothing was done about it.
There was not. You didn't have counseling in your school?
Oh no. There was nothing like that back then. And see, there's much more of an understanding now of the impact that traumatic events can have on people. But back, this would have been back in '65, there wasn't that kind of understanding. And I had, prior to that, I lived just outside of New York City during the Cuban Missile Crisis.
Feel free to have water.
Yes.
Just because we're on TV doesn't mean we can't drink water.
Well, I don't want to do a Marco Rubio on you. Anyway, so the post-traumatic stress disorder is really, I mean, it used to be called battle fatigue. And, you know, it's interesting to me that what's happened is that it went from being called battle fatigue to post-traumatic stress disorder. It's almost like the opposite of destigmatizing.
It's making it more into a disorder than it needs to be.
That's right. When it was called battle fatigue, I think that for our veterans, it was that was a better term for it, because when they're out there and their nervous system is constantly being either bombarded with things, or what's even worse is the fact that they never know around the corner there could be one of these IEDs, explosive devices, you know, that goes off like that. And they're finding that the remote technology, for example, the drones that are being used, they were expecting the pilots to actually feel less stress from those missions than the pilots that would be actually, the fighter pilots that used to go into missions. And the reason for that is that they're working longer hours, and they're
the reason that they are traumatized.
Yes, the reason why they're experiencing more trauma is because of the fact that they actually are, they're doing more missions.
And with a drone, the quality of their involvement is what? What are they doing in their missions then?
Well, they're flying. You know, they're specifically remotely flying these lightweight planes. You know, into areas and targeting. You know, targeting you know, terrorists, for example, and you know, sometimes there are casualties, you know, civilian casualties,
and that must be very troubling.
And that's very traumatic. I find that a lot of the veterans, the kind of trauma that they experience, oftentimes isn't so much what happened to them, but what happened to other people. And so, so anyway, so want to get back to a little bit of my background about
and
trauma.
I was just going to say, when you mentioned that so much of the trauma that veterans sustain is trauma at suffering of other people, it just sort of seems to say that we are innately compassionate beings, and it's very troubling to be in a setting where all of that is happening, not only to oneself, one's buddies, civilians.
But one thing that has to be understood by people is that within the military culture, buddyship is really promoted, and there's the really good part of that, in that people are they develop such a close bond in the military that they would throw their life, in front of something to save, their fellow man. And so some of the worst trauma that I've seen is when people have the guilt of, I didn't save my buddy. And so there, yes, the culture itself actually, that you're creating all of these tight connections, and then you lose somebody, oftentimes, just
right there,
and it could have been you too. So there's the survival guilt. There's the, and so it's a topic that's really relevant. How do we respond to this? How do we respond to the fact that we have all of these vets coming back with PTSD?
Right.
How do we respond to the PTSD in our communities, where you have schools, even grade schools, that don't feel protected?
And say a little more, as you wish to, about your childhood. You were about to talk about growing up in New York before you moved to Ohio. Did you want to touch a little more on some of the traumatic experiences of your childhood, or should we go on to talk about your work with vets? Or
Well, I experienced various traumas when I was a child. I never developed post-traumatic stress disorder. And so I became interested in, why is it that, and this is true for not everybody who comes back from Iraq or Afghanistan comes back with post-traumatic stress disorder. So I know a lot about the physiology of why do some people develop it and other people don't. But what I've seen is this need for more information about post-traumatic stress disorder. There's a lot of misinformation out there. So what happened to me in terms of my career was that when I went into clinical practice and left academia, because I was a neuropsychiatrist when I was at Harvard, and when I went into private practice, I was expecting to hang my shingle and be a neuropsychiatrist. And what happened was that my practice quickly filled up with all these women who had been sexually traumatized. And because they had been traumatized, some of them by therapists as well, they knew, with a name like Diane, I was obviously a woman, and with a name like Diane Powell, I obviously spoke English. And so, and then the word spread, that I was someone who would listen to them and knew how to work with them. And what I found is that there's a lot of things that are done that are counterproductive for post-traumatic stress disorder. I think a lot of people don't realize that therapy, just like medication, it can have side effects. And one of the problems is that when people have post-traumatic stress disorder, their nervous system is on hyper alert. It's hyper vigilant. And there's a reason for that. They've adapted to living in an environment in which you have to be ready for, what's going to happen next.
Right.
Whether or not it was an abusive household, or whether or not it was that you were
in combat
or something. Yeah. And so I developed this program, started a center for women who needed to work in a center where it was all women, so that they'd feel safe. And then what happened was, as I started talking about post-traumatic stress disorder, actually gave a grand rounds over 20 years ago.
And a grand rounds again is?
That's when you speak before other psychiatrists.
I see.
And I did that both at Balboa Hospital, which is a military hospital, and at Vista Hospital. And actually the grand rounds was actually used as a training tape for the military. And that was 20 years ago. Since then, I've learned even more, and I feel that I really need to share this with the community. And
so you
there's
feel
several
passionate about getting this information out. So let's hear the more that you've learned that you really need to share.
There's several things that people need to understand about post-traumatic stress disorder. First and foremost, people have to understand that it's treatable. Some people think that what they experienced is so traumatic that there's no return from the edge. And one of the things that I tell people is that after I started this women's center, I'm also somebody who's worked internationally. I've worked in other countries.
What kind of countries or situations?
I actually worked in the Soviet Union when it was still the Soviet Union under Gorbachev, and worked with people there who were survivors of the Stalinist purges.
So they were survivors of the almost concentration camp-like places.
Well, there was a genocide that occurred under Stalin.
Genocide. So their family members were taken and killed. And,
yes, that's right. That's right. And put into these mass graves that were unidentified. And the family that I was staying with, one of the family members, that's what she would do on the weekends, is she would go and help out with the effort to try to identify these people. But getting back to my work is that I went to this. I've always been a supporter of Tibet and organizations that are trying to, restore some, control over their destiny to Tibet. And I was at one of these meetings, and I met this gentleman who was starting up this organization, Survivors of Torture International, as the clinical director, and he said, "We're going to need a psychiatrist." And I had a full practice. I had an eating disorders clinic at the time. I had a lot going on, and yet I said, I remembered that there was nothing available for me when I was going through my childhood. Nobody explained it. I had to work it out myself. And then I also, when I went through, believe it or not, when I went through my training and residency, we didn't talk about post-traumatic stress disorder. That was not training specifically for post-traumatic stress disorder is not in the background of a lot of psychiatrists that are from my generation.
Sounds literally crazy to me.
And so I have been seeing it to, not only in the women that I worked with, but I actually agreed to take this position with Survivors of Torture International. And what that organization did was that they created a center for people who were refugees and asylum seekers from all over the world. Who, many of them are human rights activists who had been tortured, for example, women who had been tortured in Algeria for passing out literature to other women that they didn't have to put up with certain things. They'd be put into prison and raped, and in these Muslim countries, I mean, then you're really, it's one of those things. Instead of people feeling compassion for you, oftentimes it's like you're contaminated goods. So it's. There's all these layers of complexity to it. I worked with people from Burundi and Rwanda, where there was massive genocide. And the people that I worked with the most were actually the ones who were mixed race. They were both the Tutsis and the Hutu.
Oh, so that would have been hard for them.
Oh, because everybody disliked them.
Right, or hated, maybe.
They could be killed by either side. And so a lot of them, came to the center. I worked with the Lost Boys of Sudan. And that's a story of these children where the civil war was going on, and they were recruiting young boys for combat, and they were killing, the parents. And these boys were basically orphaned, and they took off and walked clear across the country to a refugee camp. And in deserts, and many of them died along the way, and they had nothing to eat and couldn't drink. And so when I saw these people, I mean, some of them really looked like the Walking Dead in a way. The light was not in their eyes. The deadness of the gaze, yeah. The light was not in their eyes. And after working with them for a few months, smiling, laughing, just unbelievable transformation. And so people need to know that's possible. And if you can have that kind of transformation in somebody who has that kind, I mean, some of these people had their family members killed in front of them.
Right.
And in our culture, a lot of people think, oh, there's no therapy that can help me with that. I just need my family back, and nobody's going to give me my family back, so they don't get help.
So that's very good news that PTSD is treatable.
Yes.
And one can come back from it.
That's right, that's right. And then the second thing that I think is really important for people to understand is that if it's not treated, it becomes chronic. I mean, there are people who develop PTSD during World War I who still have it if they haven't gotten treatment and they're still alive.
So it's really important to get treatment.
That's right. And the earlier you intervene, the better. But, it's still treatable, even if people come to me 15 years later. Or another clinician for treatment. But, excuse me, I've got a little more water.
Okay, I'll take this opportunity to share the water break with you.
So one of the things that I've seen is that there isn't enough crosstalk between the people who really understand trauma and a lot of and the medical community and so that's what I'm trying to do is help to bridge those two fields, because when I studied trauma, and I've also seen this with my patients as I've worked with them, and what's very important is to not re-traumatize the patient in therapy. And oftentimes people avoid therapy because they're afraid that the therapist is going to make them relive the experience by having to tell the story, and they're
It's too frightening to go there.
Yes,
Yeah.
oh my gosh! I mean, it's because they have flashbacks and nightmares, and a lot of these people they feel out of control when these emotions come up, and so anyway, so that's that's one thing, but the other thing is that people with PTSD oftentimes have nightmares in which they relive these experiences. And actually those nightmares re-traumatize them. They actually perpetuate the post-traumatic stress disorder. So
it keeps them lodged in it.
Yeah, it's almost because our brain treats dreams, particularly those kinds of dreams, as though it really happened.
And so the body is all...
Oh yeah, yeah. That's why when people they'll have a dream and they'll just wake up and they're like this. It's like it really happened to them again. And even though rationally they know I just dreamed it, it's as though they were. And so that keeps the nervous system in this state that is. Hypervigilant, high alert, difficulty trusting, and so as a therapist, when you're working with people who have that kind of nervous system, what you want to do is you want to induce a state of relaxation in them.
Right.
What you want is you don't want to re-traumatize them. You don't really need to know all the details of what happened.
They don't need more of that.
No, they don't need that. What they need is actually to learn how to relax and learn how to actually be able to pair that relaxed state with being able to think of that experience.
Right.
So that's what you're trying to do.
Yeah. And you were saying earlier that you were concerned because it sounded to you, and I think I've heard about this too, that in the military sometimes there's been an embracing of an immersion technique of taking people into similar inputs as the original trauma, and that could exacerbate things.
That's right. I mean, I read it in the psychiatric journals, and I've also heard this from people who have worked at VAs that, and I've also heard it from vets. I saw a vet in my office a couple of months ago who had been at a VA for over 5 years, and he was cleared of PTSD, and yet when he came to see me, he had all of the symptoms of PTSD. And he didn't even know what PTSD was, and I had to explain to him what PTSD was, and he goes, "Yeah, that's me."
And do we want to take time for you to explain what it is here? Because I don't think we've quite done that in this show. At some point, we have 10 minutes or so.
Okay, yeah, I'm happy to explain, because I think a lot of people do come back confused. They don't know what's wrong with them. They just know something's not right, and oftentimes, they they may, they're susceptible to using substances to try to, feel better, alcohol or whatever, or, or just escaping. And yet these are people who, a lot of the people in the military, they are such hard workers, such, these are people who, they've given us the best that they can, and we really need to give them the best that we can.
Exactly.
And that's why I'm here.
Yeah.
So some of the symptoms that people have when they have post-traumatic stress disorder is, for example, nightmares where they're reliving the event, or flashbacks, where it might be the 4th of July and somebody's deciding to, celebrate it, a week early, and they hear something that sounds like a gunshot. With these IEDs, those are hidden underneath garbage, animal carcasses.
Can you define that?
These are these explosive devices, and so they use objects along the side of the road to cover them up. So
it could be anything like a garbage can.
That's right. And so this one vet said to me that if he's driving down a street here, if he's driving around a street here, if anything has changed on that street, somebody's put out a garbage can, or there's a dead animal, or anything like that, he immediately goes into this, because of the fact that's how these IEDs were.
And so it makes it feel unsafe here.
It makes it feel unsafe here, and then in fact he only uses the same roads, even if it'll take him a lot longer.
So he can recognize the differences.
That's right. So because he doesn't want to go down a road that he doesn't know what should be there and what shouldn't be there, and and so he was a top gunner, and so when you're a top gunner, you're the one who's up there aware. You're constantly vigilant for these sorts of things. So anyway, so oftentimes what happens with PTSD is people have a numbing. It's not necessarily that you're always in an anxiety state. So oftentimes people, it's a numbing, it's a disinterest in things.
It makes it hard to concentrate.
Oh, absolutely, makes it hard to concentrate. And there's an avoidance of things that are going to remind you.
Right, but that can be a lot of things.
And that can,
so
as I said, it could be just
narrow.
Exactly, as I said, it could just be driving down here, driving down, Spring Street instead of McAndrews.
Right.
Could be, something that's difficult. So, but as I said, it's highly treatable, and yet the military is using exposure therapy.
And can you say what that is, and then why that you sense that may not be the best for everyone?
Well, oftentimes they're shown, and I've heard this from vets, they're shown combat movies. But being shown combat movies, as a group without having a therapist there, making sure you're in a relaxed state, and what you're doing is you're actually
heightening the trauma.
Heightening the trauma. Right. So then what it does is that it makes people don't. Some people will have faith, and they'll keep coming back to something that
they think is going to work
because they have trust. They have trust. The system knows what it's doing, and then other people will just back off and say, "I'm not doing that. It's making things worse." And then they think that there's nothing. It's not treatable.
Right. And so you're here to say that it is treatable, and that there are ways of bringing in other inputs that help offset that.
That's right.
And coaching ways of living now and moving forward. There's a book about the time cure for post-traumatic stress that I became aware of recently. I haven't read the book, I listened to an interview, but the basic tenet was that time location can be a helpful thing to look at. With PTSD, so often we're living in the past. It seems like now, but then we're having to make sure to go on a street where we know everything. We're living as if in the past, and then over time to be able to locate here in the present time and even create a fulfilling future. I mean, it's the arc we want for people we work with. It's the arc we want for ourselves to extricate from trauma of the past and have a thriving life in the now and the future. And so that's the hope with the work that you do.
Right. And a lot of people, they think, how do you ever get over that kind of past?
And it is a great question. I did want to just honor Edward Tick, who's written a book called War in the Soul. He helped me to understand it in a little different way with his different use of those letters, PTSD. he now calls it post-traumatic soul distress, because his point is any soul exposed to those experiences would be in profound distress. So, you know, of course our souls aren't really designed for that, I don't think, for the intensities of combat or experiencing our own suffering or others at the magnitude that people with PTSD have had to experience.
Yeah, yeah.
And you were talking about some of the physiological aspects of PTSD, I think.
Yes, yes.
You want to say a little about that? We have 2 or 3 minutes, I think.
Oh, okay. Well, what happens in PTSD is there's a part of the brain called the amygdala, and that's the part of the brain that that basically assigns the emotion to a stimuli and the intensity. So, for example, if I had been attacked by a brown dog, then, you know, my amygdala, if I saw a brown dog, my amygdala would automatically send to me, you know, danger.
Fight, flight signals.
Yeah, exactly.
Yeah.
And I'd have the adrenaline and everything going. But, you know, the brown dog might be, you know, my little dachshund or something,
Yeah.
You know, very non-threatening, but it's not a thought process. It's actually happening in a physiological, like, it's a like a knee jerk. It's a physiological thing. It's not representative of one's mind. It's a representation of how their nervous system has had to adapt to what is an unnatural environment.
Yes.
Just like astronauts have to adapt to what's an unnatural environment, and when they come back, they need a certain amount of deconditioning, you know, in order to then adapt to this environment. And although the military, tries to do that, I think one of the problems is that, as you've said, even those who aren't the most symptomatic, first of all, the ones who are really symptomatic, there's a long waiting list for treatment. And so that's another piece, is that I think there needs to be a lot of training of people who, you know, people don't have to have a medical degree like me, you know,
Right.
in order to treat these people. And
Right.
so
that's a great idea, to create a cadre of people, a massive amount of people that can be present.
That's right.
For those returning from combat situations.
That's right. Educate families. Educate,
Yes.
you know, educate the community. You know, so that people understand.
So what, you know, although we're completing mode here, I do want to help facilitate you getting at the doorway to educate families or communities. If there's something pithy you could say right now even that would be helpful for families and communities to at least understand or know, to be present in a good way for these people returning from combat situations. I don't know if that's too tall an order with a short period of time.
Well, I think that what I would say is that we're all individuals, and so you can have different traumas affect different people differently.
Well
And another misunderstanding is, I've seen people who they experience a trauma, but because they know 10 other people who experienced, you know, something that was more traumatic, then they almost feel like they don't have a right,
Like they don't have a right
to get treatment, or that they don't really have a problem. And yet it's not about do I have a problem? It's about how can I optimize my life?
Right, quality of life. How can I reach for that?
Quality of life, yes,
Yeah.
exactly. Instead of thinking of it in terms of it's a disorder and the stigma attached to it, it's really needs to be destigmatized. People need to be received, you know, in a way, and work with it in a way in which they don't get re-traumatized, and that's what
right.
it's all about.
Yeah, and it's like reaching, as we said, for quality of life, and life is precious, and we know that, and certainly a person that's been through all of that would know that, and perhaps want to maximize the years that they have, the time that they have.
That's right.
To be able to enjoy their life, their family.
Yes.
Yeah, and it is possible. I think that's one of the major messages that is coming from what we're sharing here.
It's not just possible. It really, people shouldn't settle for PTSD.
Exactly, and it doesn't have to be there.
It really is highly treatable.
And how wonderful it will be when PTSD for any given individual is just left lying on the floor somewhere. It's not part of your life anymore. You can know that it was there, but how nice to be liberated. And so thank you for coming to share with us on this very important topic. And may you all find freedom from entanglements of the past to live a fulfilling life. That's I think, what we all want. So blessings on that journey, and join us again Monday evenings, 9:30 p.m., Channel 15 in the Rogue Valley, Southern Oregon. Take care. Bye-bye.